A briefing. Today we're joined by our Medical Officer of Health, Dr. Eileen de Villa. Please go ahead, Dr. de Villa.
We have continued to see a steady increase in new COVID-19 infections.
Sorry. Apparently there's an audio problem.
Okay. So we'll get back. Are we good?
Yeah.
Okay. So since Friday, we have continued to see a steady increase in new COVID-19 infections in our city. Today, there are 58 new COVID-19 infections. This brings our total to 16,477. A total of 14,794 have recovered from the virus. I've been cautioning that we should expect an increase in cases as more people interacted over the summer and as they spend more time inside this fall. But I want to stress again that we are not powerless here. There is so much that is under our control and that we can do to keep resurgence in check. We need to think about what it is that we're doing, the risks of our actions, and if they're worth it. That's a decision only you can make. But I urge you to think through these decisions in the context of what's important to you, rather than just take your chances with your own health or anyone else's. That said, I'm going to turn right away to the return to school, because these days, so many people are understandably wondering the same thing. What's being done to keep school safe? How will I know if there's a COVID-19 case at my child's school? And what do I do if there is? This information will soon be sent home to parents through their child's school. But let's go through this today. First, a case at your child's school doesn't necessarily mean there is widespread infection. Plans are in place to limit spread of COVID-19 as much as possible. Over the summer, my team worked with local schools to help them plan reopening. These plans include things we've learned from other places where schools already back. We have examples to follow about what works and what doesn't. We have also assigned over 200 staff expressly to support schools, students, and families. We have a school liaison team to provide advice on infection prevention and control measures, train staff, and work with investigators if cases emerge at a school. There are also dedicated school case and contact management staff so that case investigation and contact tracing begin quickly. Appropriate steps are taken within the school, and importantly, communication to families keeps them informed about what to do and what happens next. One of the things we know works best is to keep children who don't seem well from going to school in the first place. Every day, you should screen your children for any COVID-19 symptoms. Keep them home from school if they show any signs of illness or have been in close contact with someone diagnosed with COVID-19. Contact your doctor, Telehealth Ontario, or our Toronto Public Health Hotline if you have questions about what to do next. Anyone with symptoms of COVID-19 should get tested at an assessment center. But most days, most children will be in class. So what happens if someone tests positive for COVID-19 in a class cohort or a designated group, or within the population at your child's school. First, parents will be notified by Toronto Public Health if there is a positive case in the school. The identity of the person who tested positive for COVID-19 will be kept private. This is personal health information. Remember, not all students are at risk if there's a positive case in the school. Next, our investigators will work with the person who tested positive and their parents to find out where they might have gotten the infection and who they might have passed it on to. This includes work to determine who they were in close contact with at school while they were contagious. At the beginning of contact tracing, all students in a class cohort will likely be considered close contacts and sent home. If your child isn't in an affected class, they can continue to go to school as usual, but you should monitor your child for any signs of illness. All students who are sent home will be instructed to stay home and self-isolate for 14 days, monitor for symptoms of COVID-19, and get tested if symptoms developed or if directed by my team at Toronto Public Health. My team will continue to monitor and support these students and their families. If more COVID-19 infections are found, parents will be notified. Students will be allowed to return to school as soon as the investigation finds that it's safe for them to do so. Anyone who tests positive for COVID-19 will have to be out of school for at least 14 days. Toronto Public Health will work directly with the family to determine when it is safe for them to come back. Another thing I want to talk about briefly is the concept of outbreak. Outbreak is a technical term that we use in public health practice. And in the school setting, it has been defined by the province as 2 or more cases of COVID-19 in a 14-day period with at least one of the cases linked to the school. And here it's important to note that a link to the school can include busing to or from school and before or after school programs. So if you hear or read about a COVID-19 outbreak in a school setting, it doesn't necessarily mean that there is widespread infection happening in that setting. It means that there are 2 or more COVID-19 cases in that school setting with a common link. The important thing for you to do is to follow this protocol as it applies to your child. This is the process my team has developed to keep parents informed. And as mentioned earlier, you'll soon receive a written document detailing this whole process from your school very soon. These COVID-19 protocols are in place to manage cases when they occur in schools and to communicate these details to parents, caregivers, and the community. That way, you can understand what's happening, the level of risk, and what you should do. Lastly, I ask that you please make sure that your child's vaccinations are up to date, including getting the flu vaccine this fall. Back to school is receiving more attention this year, perhaps more than ever. And given that COVID-19 continues to circulate in our city, this makes sense. But it's really important to note that in order for our schools to operate as safely as possible, we need everyone, and I do mean everyone, to pitch in and do their part to keep reducing virus spread, whether we've got kids in school or not. Because the amount of virus spread in our schools depends on the amount of virus spread in our community. This is why I urge you to keep following public health measures so we can keep the numbers and the risks as low as possible in our community and in our schools. These measures, these public health measures, surely sound familiar to you, but they are tried and they are true. Wash your hands, watch your distance, and wear your masks to reduce virus spread. I truly wish I could say that there won't be cases, that there won't be any cases of COVID-19 in our schools, but we know there will be. Everyone in our community must do their part to help limit the number of cases. My team at Toronto Public Health continues to work very hard to support our schools, our students, their families, and everyone else in our city. By doing your part, by following public health advice, you're protecting our children, our teachers, and our community from potential illness. You're also sending the important message that you take the health of others as seriously as you take your own. And I ask you to imagine what's possible if together we do just that. So thank you, and I'm happy to take any questions that you may have.
Thank you, Dr. de Villa. We'll now take questions. As a reminder, each media representative can ask one question and one follow-up. Before we get to your question, just wanted to let you know that we do have staff on the line who can also answer your questions. First up, we have Dan Drigo with Global News. Dan, go ahead.
Hi, Doctor. Just noting the recent rise in cases and what we've heard coming out of BC as they reimpose some of their restrictions. Is there any indication that we'll see that here in Ontario, in Toronto, soon?
Well, Dan, thanks for your question. I'm not sure that I can speak for the entire province, but I can certainly say that here in the city of Toronto, our constant action has been to monitor the activity that's happening and to adjust the public health response in accordance with activity that we see in the community. So you're probably, I hope, watching our monitoring dashboard. We certainly are at Toronto Public Health to determine what level of virus spread and containment there is and how prepared our system is to diagnose cases early, to follow them up, and to limit spread as much as possible, and as well to look at healthcare capacity and public health capacity. So right now, we have put in a number of measures in place, and we feel that at this stage, the best thing that we can do is continue to get the buy-in from our public around the public health measures. We know that imposing more significant public health measures, particularly broad-based public health measures, similar to what we experienced in the spring, certainly has a benefit in terms of controlling COVID-19 spread, but it does come at a significant cost. So where possible, we'd like to try to target and focus as much as possible, and as well, we would like people to really stick to public health measures because we know that they work. We know that physical distancing, watching your distance, wearing your mask, washing your hands, when we all do this together, it really does bring down COVID-19 spread and allows us to continue to have these other elements of life, other activities within our society, which are also important for our health, for our economy, and for our quality of life.
Did you have a follow-up, Dan?
Hi, yes. Just in terms of that specific limit, is there a specific amount of cases that we need to see or a specific increase in infection for us to start looking at going back to phase 1, phase 2, the rest?
So there isn't a singular number, nor is there one single indicator that we focus on. On the contrary, it is the sum total of all the indicators that we look at so that we can make decisions around what makes sense from a public health perspective, trying to balance that issue, as I discussed earlier, the notion of containing COVID-19 spread as much as possible, while at the same time ensuring we're doing what we can to preserve activities in our society that allow us to enjoy, a broader sense of health, a sense of well-being, and to ensure that we have economic strength as well. So delicate balance, and it certainly can't ride on one indicator. Again, I can't emphasize enough, though, how it really is within our power. We do have the opportunity to really control virus spread by doing all those public health measures until such time as we get effective treatments and or vaccines that then allow us to have a little more latitude and a little more freedom.
Next, we have Jennifer Pagliaro with the Toronto Star. Go ahead, Jennifer.
Thanks, Lenore. Hey, Dr. de Villa. I wanted to ask about the information you outlined about schools. In terms of notifying parents, will they be notified of every case that may occur in the school, not just if it reaches that provincial outbreak status? And are you expecting a letter home to parents the way other infectious diseases are sometimes communicated?
Yes, so you can well imagine that our COVID-19 approach to schools is premised on the fact that we do manage infectious diseases within the school communities on a regular basis. So while managing COVID-19 with schools in operation is new for all of us, managing infectious diseases and infectious disease outbreaks in schools is not new. So yes, we will be communicating with parents in school communities when there are cases within their schools, including single cases. And as well, my understanding is that schools have arrangements with their respective school boards to provide reports as well. So those may be on the school website, on the school board website as well. So I think there will be quite a bit of communication, because we're trying to make sure all together that our school communities and parents are aware of what's happening so that they can inform themselves in a manner that they can take appropriate actions to protect their own health and the health of their families.
Did you have a follow-up, Jennifer?
Yeah, thanks, Lenore. And is there going to be any centralized place the way there was for shelters and other locations where the public can see if there's been an outbreak at a Toronto school, that 2 or more case scenario?
So, Jen, I don't have all the specific details on how and what exactly it will look like, but I can tell you that the team at Toronto Public Health and I have been discussing this very issue. And we're they're actually working on a website or on a place, a repository that is publicly accessible so that people can understand what is happening in the community in terms of outbreaks in various congregate settings, schools included. So I think you're going to be seeing, more and more efforts as we're continuing to develop our COVID-19 response, learning from the situation and ensuring that we're communicating more and more in a manner that makes sense to our public.
Next, we have Scott Lightfoot with CTV. Go ahead, Scott.
Good afternoon, Dr. de Villa. I was wondering if I could ask about after-hours clubs and unlicensed venues here in the city. There's some attention that's being focused on due to a shooting earlier this week, and neighbors say they were quite concerned about it. But I'm wondering if these establishments are a public health concern to you, as they are not monitored by health inspectors, and there's no way to know if they're undertaking any type of COVID prevention protocol or regulations.
So I think you ask an excellent question, Scott, and I think what I can say is that, look, what we understand of COVID-19, now having lived with this virus in our community for many months now, is that crowds and people getting together in close contact type settings, and especially in indoor closed spaces, present a risk for COVID-19. So first and foremost, we would ask that people, one, neither organize those kinds of settings or events in those kinds of settings, and two, to not participate in those events, especially if you're interested in protecting your own health and the health of those around you. Beyond that, there are provincial regulations around what size of gathering is allowed within indoor settings. And we would certainly encourage business providers to stay within provincial regulations and within provincial laws, and as well city bylaws, as this is just good practice. Beyond that, I would just say that, look, we are all trying to manage through COVID-19, and it's a very complicated, virus for us to manage, particularly given that we don't, at this point in time, have effective treatments or effective vaccines. And we've seen the kind of havoc it can wreak, both in terms of our health. We've seen some tragic outcomes. We've lost members of our community to this virus. So, insofar as we're concerned about our community, and concerned about our shared and collective health, I would again remind people and ask people to follow public health measures, and that does include avoiding those closed indoor spaces with crowds and lots of close contact, as these are the kinds of settings that we know really give rise to COVID-19 transmission.
Did you have a follow-up, Scott?
Yeah, just briefly, I know that parties have been one of those sources of transmission in some places, and I'm wondering if you're concerned. I don't know if you're aware if there are any transmissions based on after-hours clubs or unlicensed bars, restaurants, kind of things, but is there a concern that people may be less likely to volunteer information, which would help with contact tracing, if they are in places where common sense says they shouldn't be?
Well, I think that when it comes to disclosing information around COVID-19, certainly it has been our experience that there are sometimes challenges in case management, in getting that kind of information. We've found that with COVID-19, but when I look back at public health practice writ large, this is something we often see with other infectious disease situations. But again, we're appealing to people. And I know our case managers and investigators do this as well. We have very honest conversation with those who are identified as cases and or close contacts. And we try to help people understand why it is that we're asking them these questions and what it is that we're seeking to do. And it's not to be punitive, and it's not to make people feel bad. What we're trying to do is control risk in the community and to minimize harms. And in our experience, most people aren't interested in hurting other people. While people may be interested in socializing and having fun, I would hazard that most of us wouldn't want to do that at the expense of others or their health. So this is the kind of conversation we will have within the context of case and contact management. And generally, it is successful. I'm not going to say that it's perfect every single time, but I think most people do appreciate that there is some risk, and when those risks are pointed out to them, they're more likely to comply. When you understand what it is you're being asked to do and why you're being asked to do something or to take a certain course of action, we do find that most people are willing to comply and aren't particularly interested in harming others around them.
Our last question today goes to Francine Copin with the Toronto Star. Please go ahead, Francine.
Oh, hi, Dr. de Villa. My questions are about travel. Back in February, it was easy to understand how international travel was resulting in COVID-19 cases in Toronto. People were traveling to places where there were outbreaks and bringing the bug back home. But now we're seeing an increase in cases related to travel within Canada. And that's, I think, less intuitively understood. Why do you think travel within Canada is leading to an increase in cases in Toronto?
Well, I think that when we look at our case numbers right now, and you're right, travel figured prominently at the beginning of our outbreak. It then dipped down after that as travel became more restricted. And when I look at our data here in Toronto at this point in time, travel is figuring again into the reasons why cases are rising in our city. And it is, yes, some travel within Canada, and as well, travel outside of Canada. I don't think it's unique to one setting or another. We know that there are travel-associated cases. And why is that? It's simply because COVID-19 is circulating in communities all over the world. It is circulating here in Toronto. It is circulating in other communities in Canada, and yes, it's circulating in communities in countries all over the world, many of which are the travel destinations of Canadians and Torontonians. So by virtue of the fact that people are out there traveling to different locations where there is COVID-19 in those communities, they're interacting with other people, and especially if they're interacting in those conditions that we know give rise to COVID-19 spread from one person to the next. Those conditions that are higher risk, in closed spaces, with close contact, without sometimes appropriate precautions like masks, and or with crowds. These are the conditions, regardless of where you are, that give rise to higher risk, and I think that that's what we're seeing.
Did you have a follow-up, Francine?
Yes, we're also seeing more cases among youth, and I'm wondering if that's due to testing. Perhaps their precarious employment, they're more likely to be in a job that is facing the public, or is it related to their behavior?
So our team at Toronto Public Health is absolutely digging into this in further detail, and it's my hope to bring forward in the next, few press briefings upcoming some information in this regard. At a very high level, I can tell you that within the last week or two, we have seen a number of infections in our city amongst younger people, those who are under 40 years of age, associated with socializing in closed settings and without the use of masks or appropriate physical distancing. So that's certainly something. There are perhaps some employment conditions that may give rise to higher risk as well. I admit I haven't seen specific details on that, but what I have seen in the last couple of weeks are incidents of infections arising with socializing, without physical distancing, without mask wearing, and in short, just not following public health measures. So this is something that we really do want to drive home with our youth. And I think it's important for young people to realize that, yes, it is true that as a younger and usually healthier individual, COVID-19 infections tend not to lead as frequently to death or hospitalization as they do in older populations. But that doesn't mean that it's without consequence. And in fact, there is a growing science and a growing literature demonstrating and showing that there are long-term effects that are being experienced by young people well after their COVID-19 infection. Effects on their heart, on their lungs, on their brain, chronic fatigue, these kinds of long-lasting symptoms. So I would ask young people to make their choices carefully and to think about what might happen, because there is no guarantee that a COVID-19 infection is just like a cold. You get sick and just get better.
That's it for today. Thanks, everyone, and have a great afternoon.